Dear Dr. Mike, I know I asked you about the hydro not working anymore. Apparently I made a video about that. But I've also been on 7.5 milligrams of Oxy, 90 a month. That didn't help either. Do you have any suggestions? That is a very wide conversation. I probably need more context. However, let's start with a few basic things. One, I don't really consider going to long acting until 4 times a day of a short acting isn't working. So you were on that one before, and the main thing that I would say about that is if you were going to go back to it, I would try it again, but with 4 times a day. The second thing is, I don't think people have given you a good enough conversation about activity clustering and about taking the medication because of what you either are doing or are fixing to do. Yes, that's right. We in the South, we fixing to do it. And basically clustering your activity around your pain medications for it to be the most effective. I have a suspicion that when you used it before, they told you to take it basically like a 6-2-10 kind of thing. And that's what I call the pain blanket. And I have several videos in the past, but I haven't said this in a while, and I haven't stirred up the rat's nest. So thank you for giving me an opportunity of talking about something that I don't think works all that well, and that's the pain blanket. The pain blanket is the presumption that if you always have the medicine on board, that basically pain will have a harder time getting through the defenses, and basically you can live a more comfortable life. And I don't find that to be the truth, especially with short acting. Because first of all, no short acting, so when you take 3 times a day, no short acting medication lasts for 8 hours, okay? So already you have an inherent problem with the pain blanket. If that's supposed to keep pain from hurting you, then you've already got a half your day that is not going to have medicine effectively in your system, okay? So already this is not going to work, okay? The second reason why pain blankets don't work, though, is because when you have pain in spite of the medication, you begin to wonder that something's wrong. It's a constant mental game that we have to fight, mental battle that we have to fight. So let me just say something about that. The goal of chronic pain relief is not to relieve pain. The goal of chronic pain management, that's the problem, is that we keep trying to use the word relief when at the best, on our best day, we are managing pain. And the goal of chronic pain management is to create life in the middle of pain. So once again, activity clustering, taking the medication, because in my model, the activity clustering model, if you're on 3 times a day, you really may take those first 2 doses even before lunch and just save that third one for either late evening or going to bed, okay? Depending on what a person's schedule looked like. And that goes back to why I don't usually consider long acting until the 4-day doesn't work, because most people have 4 points in which they need the medicine to be the most effective. First thing in the morning, around lunchtime, when the kids get home, and around bedtime. See, I'm going to use women here because a lot of times women are disregarded. So I'm using y'all not just because of the whole domestic thing. This is not a misogynistic post. It is just that's a reality of all of you wonderful women who try to keep a house and make a home for us. By the way, thank you. You don't get, you will never get enough credit, okay? Anyway, so I would try 4 times a day. I would try having a legitimate conversation about activity clustering and avoiding the pain blanket. And if that doesn't work, Then you might want to talk about adding a long-acting agent twice a day and having 2 or 3 short-acting in the middle of the day, okay? And again, is this medical advice? No, it's not. I can't give you medical advice, okay? But I can give you love, and I do that, no buts.